I think nursing is a great example because there are several different grades of nurse requiring several different levels of education and training. You can enter the profession while still training for a higher grade, higher level certification, but you can still be working at the same time and gaining more experience. Yet if you're a bright kid at George Washington High School on the far Upper West Side, or Roberto Clemente High on the northwest side of Chicago, I don't know if anybody's going into your biology class and saying, hey, you ought to think about being a nurse because you're going to have work for life, you'll be a respected professional, and hey, look, we're in biology class, you're doing all right, this is something you could be good at. I don't know if anybody helps plant the seed when you need to be thinking about your life in that way, when you're 15, 16, 17 years old. Is there?
I would ask Juan Carlos, because with the SEIU, you guys represent a good number of nurses, and I'm sure there are some programs.
It's our strongest industry that we have membership in. With the healthcare industry, about half of our members are members of the healthcare in some form or another. And healthcare, in addition to elderly care is as you stated in your report, the one industry that I think is truly, undeniably going to continue to grow as our population gets older and needs more health services. But your other point about education is huge. I mean, if we have such a large dropout rate in the Latino community, which is one of the highest, it is really difficult then to continue that path to a good quality job. And the other question is, if this industry continues to grow as everyone projects it will be, how do we maintain the standards of the job place so that we do have those jobs are desirable and are, I mean, they're difficult jobs. Nursing is a hard, tough job. You have to lift patients. You have to deal with pain, suffering. It's not an easy job, and if the trend is to lower salaries and to increase ratios of patients, we're gonna, it isn't as desirable as people think. So I think that again, I bring back the point. Are we going to have an economy that really is strong for and values the work of its workers, or are we going to have an economy that is basically moved and pushed forward by corporate interests? I wouldn't say small business interests. I would say we become a corporate economy, which is a big business economy. It's very different from a small business
Juan Carlos, you are someone who takes a close look at the effect of immigrant labor on job markets. Mm-hmm. If you go into any big city hospital in America, half the nursing staff was born somewhere else and trained somewhere else in the world, and here's a profession with a chronic shortage.
Well, there's estimated that there's a short of over 10,000 nurses across the United States. It pays between $60,000 to $80,000 to a visiting nurse,
Sounds
a traveling
good to me.
nurse. And I've seen a lot of the community colleges in the States, particularly in California, have done a really good job at starting to good nursing programs and do it in a way that they are able to do it conjointly with a hospital so that they can participate while they're finishing their education. But I would say a large number of the H-1Bs that are come every year is going to be nurses. The unions have been very good in requiring some national board certifications for them to qualify to come in, but the demand's there, the salaries are good, and if there's no local people to do it, all people from the Philippines and Mexico are more than glad to come in and do that work for you.
You touched on a good point. I think the number of H-1B visas needs to also be increased. I read somewhere that...
and explain what an H-1B visa is.
H-1B visa allows skilled workforce to come in from other countries with specialties, either in the nursing field, medical field, engineers, to come in and take jobs where that American companies can't fill.
But that's the thing that people sitting at home on their couch watching television are driven nuts by. The idea that there are millions of unemployed and we are importing skilled workers from places in the world that can't even properly employ them. If there were great opportunities in the Philippines to remain there and practice your profession, they would stay there. It's not that easy to move from a place halfway around the world and start up from scratch in the United States. Indian information sector is growing very quickly, but Indian engineers still want to come here. But we're not producing the people who would take those jobs
Right.
instead.
I do think we need a broader sort of labor policy and education policy.
See, there we
No,
go. Economic Policy Institute and the RNC getting together on this show.
Because like you're saying, I do think that there, nursing, if you actually have a nursing degree, nursing license, is a great job. And there are many young people of color who I would like to see, who are in the U.S., born and raised, move into that occupation. And I think in general in our high schools, I think we, on the one hand, we're not clear with what we want our educational system to do, but we do want it to serve as a sort of, we do want it to be linked to the labor market. We do want it to provide some job training and some direction. But it's not there. We haven't built the mechanisms to really, like you say, to have someone go to that biology class and say, "Hey, have you thought about nursing?" I don't think that's there, and it's a real problem in our economy. So yeah, we definitely need to do more in that area.